Hello, my name is Steve Everard. I'm the Manager for Quality Improvement for the Allegheny County Office of Intellectual Disability. Federal laws establish the federal Medicaid program known as medical assistance in Pennsylvania. Medical assistance is a cost-sharing arrangement between Pennsylvania and the federal government, under which the federal government reimburses more than 50% of the cost to provide medical assistance to individuals who are eligible and unable to cover the cost of their medical care. Pennsylvania has chosen to participate in the medical assistance program, so it has to follow federal laws and regulations. Federal law requires that Pennsylvania offers certain services such as inpatient hospital services and doctor services. Some types of medical services are optional, such as dental care and medications, but a state can decide to include them in a state plan. Most community intellectual disability services, such as habilitation services, vocational training, respite care, environmental modifications, and socialization day programs, cannot be covered as either mandatory or optional services under medical assistance. Pennsylvania has permission from the federal government to offer home and community-based intellectual disability services. This permission is a waiver of the federal rules, so it is called a waiver. The purpose of the waiver is to encourage states to provide services to assist individuals with disabilities to avoid institutionalization. Pennsylvania has two waivers for people with intellectual disabilities. One is called the Consolidated Waiver, and one is called the Person-Family Directed Support Waiver. The Consolidated Waiver is the primary funding source for community-based intellectual disability services in Pennsylvania. Here are the eligibility criteria for Consolidated Waiver services. Be age 3 and older, have a diagnosis of an intellectual disability, require active treatment, be recommended for an intermediate care facility level of care based on a medical evaluation, be determined eligible for medical assistance, $2,000 resource limit. This does not apply to dependent children under age 21. Income limit is 300% of the federal benefit rate. The Consolidated Waiver offers a broad range of community-based intellectual disability services depending upon the participant's needs, including but not limited to assistive technology, behavior support, companion, education support, home accessibility adaptations, home and community habilitation unlicensed, homemaker chore, licensed day habilitation, nursing, pre-vocational, licensed residential habilitation, unlicensed residential habilitation, respite, specialized supplies, supported employment, supports broker, supports coordination, therapy, which includes physical, occupational, visual mobility, behavioral and speech and language, transitional work, transportation, and vehicle accessibility adaptations. The waiver participant and his or her support team, including involved family, legal representative, supports coordinator, and provider staff, develop an individual service plan, or ISP, that delineates what types of services the individual requires and will receive. The ISP must be reevaluated at least once a year and changed to meet the changing needs and desires of the participant. You can apply for waiver services by contacting your supports coordinator or the Mental Health and Intellectual Disability Office in your county. If you cannot find the contact information for your county, you can contact the Pennsylvania Department of Human Services Office of Developmental Programs Customer Service Line at 1-888-565-9435, that's voice, or 1-866-388-1114, which is TTY. It's important to apply for the Consolidated Waiver as soon as possible because there is a long waiting list. Currently, there are more than 4,000 Pennsylvanians with intellectual disabilities on the, quote, emergency waiting list, and over 13,000 total waiting for waiver services. If you are in the Consolidated Waiver and are not receiving the services in your ISP, you may wish to contact the Disability Rights Pennsylvania at 1-800-692-7443, that's voice, or 1-877-375-7139 TDD, or email at intake@disabilityrightspa.org.